Hey everyone, and welcome to This Explainer. I am absolutely thrilled you're here with us today. We're going to dive into a topic that is deeply personal and honestly incredibly impactful. We're talking about alternative and augmentative communication, or AAC. Here at American Wellness Center, located right in the heart of Dubai Healthcare City, we've really dedicated ourselves to this profoundly important field. My goal today is to show you exactly how AAC transforms lives and to walk you through the compassionate, evidence-based care we provide every single day. At American Wellness Center, our entire clinical philosophy really boils down to one simple, powerful idea. Every person deserves not just to survive, but to truly thrive. We firmly believe that healthcare isn't just about managing a medical condition. It's about optimizing your entire quality of life. Because when it comes to communication, surviving might just mean getting your basic needs met. But thriving means expressing your true personality, sharing a joke, making your own choices, and connecting deeply with the people you love. We are here to help you thrive. I want you to just stop for a second and imagine something. Can you imagine the sheer frustration of losing your voice? Think about how many times a day you speak. To ask for a coffee, to say I love you, to explain that you're in pain, or to just casually chime in on a conversation. When natural speech is suddenly limited or becomes unreliable, your world can instantly feel so incredibly isolating. In our experience at American Wellness Center, we see this emotional toll firsthand. And I really want you to know that if you or a loved one are experiencing this right now, you are absolutely not alone, and there is a very clear path forward.
All right, let's jump right into section 1. When communication becomes difficult, the need for support. What we consistently see with the patients we support are a variety of complex medical backgrounds. AAC support is fantastic for adults experiencing severe speech impairment following, say, a stroke or a brain injury. We also provide a lot of long-term care for folks with motor neuron disorders like ALS or other progressive neurological conditions. But, it's not always a permanent loss. Sometimes it's temporary voice loss after a surgery or speech that's just become limited because of weakness, fatigue, or breathing difficulties. Basically, if speaking takes immense effort or if the speech you produce is unclear, specialized support is absolutely necessary. So, knowing the conditions we treat, that naturally brings us to the big question of this explainer. What exactly is AAC? You've probably heard the term thrown around, but let's break down what it practically means for our patients. AAC stands for Alternative and Augmentative Communication. It basically encompasses a huge, wide range of tools and strategies. The absolute keywords here are support or replace. It's about finding any practical method to help adults express their needs, thoughts, and preferences with total clarity and confidence. At American Wellness Center, we always emphasize to our patients that AAC is not a last resort. No way. It's a highly proactive pathway to maintaining your independence, your dignity, and your meaningful connections with the world. Moving right along to Section 2. Understanding AAC solutions, from boards to eye gaze. Because there is no one-size-fits-all, we offer an incredible spectrum of customized tools. On one side, we've got low-tech AAC. These are things like customized communication boards, picture symbols, or specialized notebooks. They don't need batteries, they're super reliable, and they offer really simple, effective support. On the flip side, we have high-tech AAC. Now, these are your speech-generating devices, smart tablet-based systems, and even eye gaze or switch access systems for clients with limited mobility. Our clinical team works closely with you to pinpoint the absolute best option based entirely on your unique physical abilities, your environment, and your personal goals. And look, we can't talk about customized care without talking about culture and language, right? We're based in Dubai, which is literally one of the most dynamic and multicultural cities on Earth. So in our clinic, we provide culturally sensitive AAC support that actually respects your specific identity and language background. Many of the systems we utilize seamlessly support multiple languages, ensuring you can communicate effectively, whether you're speaking English, Arabic, or any other language you use at home. Let's tackle Section 3, dispelling common AAC myths, fears versus clinical facts. Okay, this is hands down the most frequent question we get during an initial consultation. People very often assume that if they can still make sounds, or if they have some natural speech, even if it's unreliable, they just shouldn't be using a device.
Well, the clinical answer is a resounding no. You do not need to be completely nonverbal to benefit from this. Actually, we highly recommend AAC for anyone whose speech is inconsistent or simply exhausting to produce. It's meant to be used alongside your natural speech. You can think of it as a supplementary tool to reduce your communication fatigue so you can actually save your energy for the things you really want to do.
And that leads right into the biggest fear we hear from caregivers and patients alike. If I rely on a machine to talk, will I lose the motivation to use my own voice? Is it going to stop my natural speech from coming back?
So, here is the crucial point, and it's incredibly encouraging. The evidence-based truth is exactly the opposite. Research consistently shows that using AAC actually supports and encourages the recovery of natural speech. By taking all that intense pressure and frustration out of trying to force words out, patients tend to relax. They experience successful communication, their confidence grows, and they are frequently way more willing to attempt vocalizing naturally when they have that safety net of their device right there with them.
Which brings us to Section 4, our multidisciplinary AWC approach, comprehensive, compassionate care.
When you work through our doors, you aren't just seeing a single therapist. You are gaining an entire team. Since we opened back in 2016, we've grown to a really dynamic team of over 60 highly qualified, Western-trained clinicians. This kind of scale allows us to provide a level of evidence-based care that is truly unmatched in the region. And those clinicians? They represent over 20 different medical and therapeutic specialties. Why does that matter for your AAC journey? Well, because communication doesn't happen in a vacuum. By housing over 20 specialties under one roof, our speech and language therapists can seamlessly coordinate your care with our in-house neurologists, psychologists, psychiatrists, and physiotherapists. We treat the whole person, not just the device.
Let's walk through the highly individualized journey you'll actually experience with us. We call it the patient pathway. It always kicks off with a comprehensive assessment of your physical abilities, your cognitive strengths, and your day-to-day needs. From there, we select and meticulously program the device just for you. Then comes the absolute most important part, the training. We practice in real-life scenarios, at home, at work, out in the community. And crucially, we emphasize caregiver involvement. We train your family right alongside you because they are essential for smooth communication. Plus, we provide ongoing support to tweak and adapt the device as your needs change over time. Now for the best part. Section 5, regaining your independence, the transformative impact. When our patients are empowered with the right communication tools, the benefits are literally life-changing. They immediately gain greater independence. They can reliably express not just what they physically need, but their complex emotions. This drastically improves safety and comfort in daily routines. We see a massive drop in frustration during conversations, which in turn leads to much stronger, warmer connections with family members. Ultimately, AAC opens doors, giving you back the confidence and the autonomy to make your own decisions again. I really want to offer a word of reassurance here, particularly for our listeners who are navigating progressive conditions. The solutions we provide are not static. Our AAC support is highly adaptable and flexible. It's clinically designed to grow and change with your unique needs over time. As your communication needs shift, our team at American Wellness Center remains right by your side, adjusting your technology and strategies to ensure you maintain long-term stability and independence. So, I want to leave you with this one final provocative thought. If you've been feeling silenced or just totally exhausted by the effort it takes to speak, what will you say when you finally regain the power to effortlessly communicate your world? At American Wellness Center, we are so ready to help you answer that question. You deserve to thrive. Thank you so much for joining me for this explainer today. If you're ready to take that first step towards supported communication, please reach out and schedule an assessment with our amazing team today.